So the last talk is about another report we put out. The one we talked about earlier was the most popular piece of work we did, and the one we're going to talk about now is probably the most important thing we've ever done. It's a project we did with UNICEF. UNICEF saw the retail report, and they said, they thought it was very interesting, and sure, they do a lot of buying. They're the biggest pencil buyer in the world. But the kind of healthcare organization, what needed something else. Basically, they were looking for new ideas to help healthcare workers in the field. A lot of these healthcare workers are uneducated. Some of them are illiterate. But at the same time, they played a very important role in the health of human beings and families and children. Why am I going to tell an audience of advertisers and marketing people? It's because I got a bunch of you guys to respond to the trends and come up with ideas, non-advertising ideas, to help UNICEF, really to inspire UNICEF. And so Kyle and I, we're going to take you through some of that work today. What we did is we spent some time looking at new ideas, exciting ideas that were taking place at the intersection of health and technology. And we gathered a lot of data again, loads and loads of ideas within a private PSFK. And at the end of that period, we came up with a whole bunch of ideas. We again engaged our audience. I think we asked the Purple List, if some of you are members of the Purple List, and loads of people sent us in ideas that they were spotting. And then at the end of it, I think we came up with 15 ideas, 15 themes, and somebody at UNICEF put them into special boxes and coded them in a special way. And so we're going to talk about 4 or 5 of those themes, and then I'm going to talk to you about the ideas that you guys reacted to and provided.
Yes. So as we went into this project, we encountered a number of really big questions. As we saw the challenges that UNICEF teams were facing, and these were challenges like how do we get information to remote communities, and how do we get those to healthcare workers in the field? So one of the things we started to see was this child count program. It runs off of a platform called Rapid SMS, and what it allows healthcare workers in the field to do, it allows them to register new births when a child is born and get these children into a system where they can later be cared for. Another issue that they have trouble with is getting children registered. And it allows these workers to text in relevant vital information and deliver that to a central facility so those births can be registered and those children can be tracked. We also saw another interesting example of a program called Text in the City. And what this program does is it allows adolescents to stay in constant contact with physicians. It'll either deliver important little text bites of information to teens about their sexual health or about physical health issues, or it also lets these teens text in questions that they might have difficulty answering in other contexts.
This program was targeted towards teenagers in Harlem who had, for various reasons, difficulty in accessing information about sexual health. And so it was a very successful trial program. And so we see a number of examples that kind of support this theme, and we're calling it SMS Consultation.
And what we're seeing with this trend is we're seeing examples of ways that individuals can stay constantly connected to physicians and healthcare workers through platforms like SMS and through their phones, and ways to get little bits of information back and forth between individuals and physicians and have them connected constantly.
So, we saw how technology was allowing medical staff, healthcare staff to actually talk to the end patient or the healthcare worker, but we also started to see how technology was beginning to empower the patient or the child.
And so, in the realm of this question, how is innovation allowing individuals to constantly to have more information in front of them. And this example is a cough analysis application that runs on a user's iPhone. It lets you cough into the microphone, and through that, it has access to a database of information. Through the acoustic recognition system, it can tell whether this is something that you need to look at immediately or not. And this is by no means replacing the physician, but it gives individuals that little bit more information that lets them know whether they need to act immediately or not.
Sure. I think, obviously, this is on a smartphone, very high-tech, not a piece of technology, but you can see if somebody is a day away from a medical center, has to walk for a day, the ability to help people understand their health issues before they make that trip, stop their work on the farm, is very important.
So to that note, we also started to see examples like this. This is a low-tech self-diagnosis tool that's being used at Bangalore. Essentially, it's a series of dials and rotating platforms that you can set and line up with symptoms that you may be seeing as an individual, and use that to get a better picture of what might potential conditions be. And it gives you information about conditions. It gives you information about who potentially to contact in your area. And this is information that would normally be held only by the physician, now being put in the hands of individuals without a lot of technology involved.
So we saw lots of examples, again, of this sort of theme, do-it-yourself checkup, we called it.
And what we're seeing with this trend, DIY checkup, is essentially ways that individuals can take little snapshots of their health and do that on a constant basis, do that themselves, and have a better picture of their own health and be able to make better decisions by be able to take these small snapshots.
Yeah, sure. So people are beginning to understand their health, and so what can they do? How can we understand community's health and the individual's health better? How can we react to it?
Mm-hmm. So especially on this community level, we started to see examples like Google Flu Trends, which essentially takes little bits of, it takes search queries from individuals that are talking about what sickness or illness they might be searching for, and it aggregates these into a picture that can be easily recognized, and you can easily see what
Sure. Basically, what it does is it looks at search queries that for fever, and it can predict a week earlier than medical organizations can, or healthcare organizations, about whether an oncoming flu outbreak in a certain area.
So we see that through things like Google Flu Trends, and also through programs like Ushahidi, where individuals are texting in what conditions are around them, and that builds into a bigger picture that's aggregated and put on a map. We also found this example, Sleep Cycle. It's an application that runs on your iPhone. Basically what a user does is puts it on their bed as they go to sleep. Through accelerometer motion and the detection of the noise through microphone, it can tell, it gets a picture over time of through the night of what your stage of sleep is. And not only just in one night, but it tracks this over months, and you can then get this very visual image of what your sleep habits are like. And it lets users basically adjust their sleep habits accordingly.
Sure. So, with it, this is all clustered within a trend we've called picturing your health, or picturing our health.
And within this trend, we're seeing examples that essentially give individuals a way to better visualize bits of information, put it in front of them, and put it in a way that lets them easier make decisions about their health, makes them get into better habits, as well as physicians on a community level. Now physicians have physicians have access to information that gives them a better picture of what communities look like and what the community status is.
Sure. So with all this information to hand, especially held by the individual, how do we encourage them to kind of act on it?
And so we see an example in Switch to Health, which is a simple wearable wristwatch. It basically, throughout the day, it captures users' level of fitness. It captures through accelerometer motion, stores it all on this device so that later in the day, this user can upload that information onto a personal profile that lives online. And it translates these minutes and these hours of physical activity, and it translates them into a numerical value, points. And these points can be rewarding in the sense that they translate to retailer and merchant discounts. But it's also interesting to see how these local communities are being built through the leaderboards, where users are competing with others to essentially oust other local users. And there's also this interesting question of how can similar ideas, how can they lead to better habits? What we're seeing here is a digit device produced by Bayer that plugs into a Nintendo DS system, and it's intended for small children or young children who need to check their blood glucose levels daily. What this does is, through the device, the child is able to check their blood glucose, and every time that they do, it unlocks within the games that they're playing either virtual currencies or new levels. And so it turns something that's normally a chore for the child into something that allows them to basically further their game. And so it turns this chore into something that helps them build a habit.
And so this is all about gaming for health.
And in Gaming for Health, what we're seeing is basically innovative ways that complex information is being reduced into something that makes sense in a very short-term reward. As we saw earlier, Usman was talking about how you can't particularly give users or individuals an end goal like, if you do such and such, you will be healthier in the long term. What you really need to do is give these small incentives along the way, and that's what we're seeing with a lot of the examples within this trend.
Of course, a lot of these ideas are involve kind of technology, pretty advanced technology, especially in places like Africa, in India and Pakistan. So how do we take from those take learnings and lessons from these ideas and apply them to allow it to support communities offline?
Yeah, the question being, the challenge that's come up is, how do we use low-tech solutions to get information to communities? And what we're seeing here is a project called Question Box that is being used in rural India and parts of Uganda that allows these individual communities to set up a box. Volunteer workers man the other side of the line and can answer questions that the community presents to them by having access to the internet or the mobile web. And these are things like, very basic information like, what does this symptom mean? How can I schedule an appointment with a physician? Very basic information that these communities would not have access to otherwise, now being provided to them through a community system. And we also see this example here, which is a technology called Sight on Mobile. And it's essentially a development in compression technologies that allows very rich web information to be compressed to the point where it can live on non-smartphones. So we see rich medical histories or access to physician scheduling systems that are now being able to live on phones and technology that already exist in rural communities.
So, and this is all part of what we call the offline web.
And what we're seeing in this trend, offline web, is essentially low-cost solutions to very sophisticated problems. A lot of them are built based on community involvement, building local leaders and letting them distribute information through very innovative platforms. But essentially a way to distribute very important information to individuals that would have no other way to access it.
Super. So there are just some of the trends, the manifestations, but within those trends that we identified and we presented to a number of agencies. And we looked through the focus. We asked UNICEF to give us a tighter brief, and they talked about the problems that they have in the fields, whether it's registration at birth, whether it's children, deaths and high children mortality and so forth. And so they gave us some very serious briefs, and so we talked, in front of teams of creators and planners, and we talked these through with the team there. And so I'm going to show you probably the 10 ideas which UNICEF responded to most. What happened to the report, it not only went to these guys, and obviously it's available online, they distributed it throughout the whole organization, and then they distributed it to like-minded organizations. They didn't want to keep this to themselves, which was nice. And so we could kind of share this with as many people as possible. The first is a fairly simple system, and it answers that kind of brief, which was how do we monitor, how do we register children at birth, how do we know people exist?
Yeah, and I think one of the interesting things that was part of this concept is that not only does it allow information from birth registrations to be delivered very quickly and very efficiently, it also allows for individuals around the world to sponsor these births and sponsor the cost of these births through donations. But through Facebook and text message, they're able to basically receive a notification when that birth is registered and see that information along with the physicians.
So that was created by Great Works, which is a Swedish agency, New York agency. Wyden Kennedy in New York gave us a system which connected donations directly to villages and the needs of people in those villages.
And so essentially what you're kind of seeing is this visualization of donations throughout the world, and it puts it in this very familiar platform, familiar in the sense that it looks like Farmville, social cause, a social city, and it gives a way for donations to kind of appear ambiently as status updates for users, and this, so it gives a way for these stories that are being told for when a donation helps save a child, or it helps provide water in a certain area, and that appears in a user's profile.
And Story Worldwide, they gave us a whole bunch of concepts. The one concept that stood out for UNICEF was the bag, the multiple-use bag. So this bag was given to a mother at birth. It would contain a whole load of stuff, but it was useful after that day. So the strap basically allowed you to measure the circumference of your child's head as the child grew. The bag also could carry water as well. We're all into infographics. It's the new trend. And so basically, Zamoga, which is an agency in Bogota and New York, they basically created a T-shirt that people could wear, which would teach them. So you could call Teach shirts. And they could provide simple instructions. Here it's about choking. Yeah. But it could be about CPR. And I think it was just kind of simple ways I think UNICEF enjoyed the idea of being able to provide maybe some passive communication. Obviously, I don't think you're expecting the person wearing the choking T-shirt to be choking at the time.
Well, so, kind of the idea that came along with this was, these are distributed as part of crisis relief. So, the idea is to have individuals basically act as a conduit for being ambiently aware of important information. Maybe it's choking, maybe it's CPR, but it could be any number of useful, vital information to a crisis. They really like this one, and they're thinking about how they do this one. So again, Zamoga, that agency, is about that sort of offline, online, and how do we communicate. And so they basically wanted to use Google Earth to basically track the health of villages. And so they would provide some information about how to, the healthcare worker would track the health of their village and then leave a mark on the ground. I don't know if it's a QR code, but it would leave a mark on the ground which Google Earth or another satellite system could track, which would allow them to very, very quickly
to obviously track the health of the village. For UNICEF, this is very interesting because it takes the technology out of the hands of the villagers, and often there's multiple issues about technology in villages, whether it's the stuff breaks down, or you obviously have a poorly educated community, often a poorly educated community can't use the technology. And so simple ideas like this, which then can use Western technology, could be very, very important to them, and they're very excited about this. Another example by People, Ideas and Culture in New York, which is another child registration system.
Yeah, one of the things that's important with this concept is getting back to the idea of how do we incentivize new parents to register children? How do we solve that problem of getting new children into the systems? This is essentially a way to put that in the parents' hand. The parents are the ones who text in the birth registration, and along with that comes this kind of care kit delivered by the healthcare worker upon their first visit, and also information, again, very basic information about how to care for growing children that these parents would not have access to otherwise. It's delivered to them through SMS.
This is from Cunning, the agency in New York and London, and basically this just talked about working with local artisans. There are so many different aspects of culture within every country, and making sure you work with local artists to communicate, artists who may have told stories for thousands of years, hundreds of years, and use them to communicate healthy living, healthy behavior.
So the Little Village board game is essentially a way for children to collectively compete with each other in a game that helps them understand what needs to happen to build a village. So this game provides a number of ways in which individuals are competing for points or whatever amongst themselves, but in the process they're also collectively learning what kinds of things a town needs, how to build a well, how to provide for sanitation, and create medical facilities. And the idea that kind of came out of this was, how to do this in a very low-cost way that, whether the game lives on a blackboard, but essentially, a way to get children involved in that process from an early age and start to think about, how to solve some of these more complex problems.
Okay, and this is the last idea. And this comes from BMB in New York. And this, I think it's fairly self-explanatory, what's the nice thing about it. We've all seen pictures of women with kangaroos carrying their babies. This is obviously a blanket which is given to a child at birth. There is a barcode, but more importantly, the idea is to provide information to help that mother look after their child, monitor the growth of that child. What is exciting about this is B&B have started to, have been discussing with UNICEF in Uganda about how to get this produced at a local level. There's obviously a number of things to think about, obviously the information. They think about how to localize this, put religious script on it and so forth, which is the kind of custom there. And what's exciting for me is PSFK providing inspiration, and that inspiration having impact. Our job at PSFK is to inspire you guys to make things better. So you've heard these wonderful speakers, and I want to thank those speakers for coming. But I'm hoping that from that inspiration, you go out and help the world make things better. Thanks very much today.